Hi everybody, this is going to be a super quick wrap up on chronic kidney disease because there's awesome, excellent videos that you watch from John Hopkins. So I'm not going to reinvent that because it's phenomenal, but I'm just going to go ahead and do a very quick review and I want you to think beyond. So this is where you gather those facts from watching those videos and you go beyond that. So chronic kidney disease, remember the stages, and once they're less than 15 or stage 5 kidney disease, we're ready for dialysis. Usually in stage 4 is when they will start talking to the patient about possibly headed for dialysis. And so many times that is when they plan for a graft or a fistula. How do you know they do get sent to a vascular surgeon, like the video said. The vascular surgeon will say, you know what, you're really not a good candidate for this. You really probably should have a graft. So planning ahead and being proactive is really important, which is why it's important for these people to see nephrologists early on. So risk factors, as we talked about and you heard about, was diabetes is number one, long-standing hypertension. These people need to be in a nephrologist office at stage 3. And I treat many patients with diabetes and they are stage 2 to stage 3, and sometimes I will send them over in stage 2. How am I preventing this? If they're diabetic, I want to make sure that their kidneys are perfusing as to the maximum as possible. So I will go ahead and start putting them more on that moderate protein diet, monitor their electrolytes, have them on an ACE inhibitor. Lisinopril is just one. There's quinapril, lisinopril, ramipril. There's a whole bunch, the ILs, ACE inhibitors. Because remember, where those work, go back to the RAAS system, but it just helps dilate those the artery in the kidneys and helps blood flow better. So that will help increase kidney perfusion, which is what we want. We don't want to have a lack of perfusion. Okay, so the other thing with this is the diet again. Remember the sodium, about less than 2 grams a day. And if you're have never done this, go to the grocery store with the mask, I guess now. Go to the grocery store and look at the labels. If you look at soy sauce, for I think it's 1 teaspoon or 1 tablespoon has 1,000 grams in it. So it's not very hard to get to 2 grams a day if they're eating processed foods, the fast foods. Again, these people should stay away from fast foods, period, because of the sodium, because of the phosphorus. You know, the preservatives in there is what can cause damage. So shop the perimeter of the store. Decrease your potassium. Decrease your phosphorus, as I said, and also that's dairy and meats. And as the video, the physicians had mentioned, nephrologists, it's difficult for these patients to eat. It goes down to, gosh, what do I eat? Water we usually don't restrict with chronic kidney disease, although remember, it's tailored for every person. This is different than acute kidney injury. If someone has an acute kidney injury, we need to possibly restrict the fluid because we need to find the cause and what's going on and be a little bit more aggressive with an acute kidney injury because we don't want that to go into a chronic issue. I can't stress enough to avoid NSAIDs. Milk of magnesia, just because it's over the counter, does not make it safe. And a lot of people think that. Many people think that. They think, oh, well, it's ibuprofen. I mean, but if it's taken for what it's tended to be used for, which means it'll say as needed for a short amount of time, then it's okay. Someone with kidney disease, though, and it'll say on the label, if you have kidney disease, please consult your doctor. Because remember, medications are metabolize kidneys or liver, and NSAIDs are in the kidneys. And again, we talked about the contrast. The last thing I want to say, fistula graft catheter. Yes, you were shown what that is, but go beyond that. What happens if you have a patient with a fistula? What if they're a post-op fistula and they're staying overnight just to monitor their cardiac rhythm or whatever you're watching? Usually it's outpatient, but what are you going to watch for? What if a patient comes in for dialysis and you happen to be a dialysis nurse? What are you going to watch for? How are you going to know it's working? You're going to listen, you're going to feel, Okay, because remember, you're going to hear the thrill and the bruit. All right, so you feel the thrill and you can hear the bruit. That's the way you know it's working. What if all of a sudden, what if it's not working? You're not going to start dialysis, right? Let's see, what else? What if the patient comes in, she's like, gosh, my hand, it's cold and it just feels numb. What's going on? Is there a blood clot? Is something blocked off there? So you have to think, remember, it's a vascular access. So think about all the things that can go wrong in this area. Um, the other thing, let's think about peritoneal dialysis. How are you going to, so we learn how to do peritoneal dialysis. You're giving the diacylate with a certain amount of electrolytes in there. Also, there's lactate in a dialysate, which acts as a buffer for balance. Again, it's a balancing act. But with these people, how do you know? What if a patient you have on the floor does peritoneal dialysis? So you need to be there and help them hook it up. What are they going to, how do you know if it's okay or not? What if they say, oh, it really hurts when this fluid's going in? Well, that's normal to a point. Obviously, if it's severe, that's not. But usually a little bit of pressure or just a different feeling. Think about fluid going into your abdomen. So it'd probably feel a little bit more uncomfortable. But remember, with this catheter, the peritoneal dialysis catheter, as well as this catheter here for dialysis, there's something sticking out. So infection. So you got to think infection. How's the site look? What's the fluid look like? That fluid coming out. Is it clear? Is it cloudy? So if it's cloudy, that's telling me, oh my, is there an infection? So that's not normal. So those are things that I want you to think about as you're going through your study guides, review guides, is go beyond what you're learning on the, like we're telling you facts, but now what's the nursing process? Think about a scenario. You have this patient here and you check their weight and it's really low and you're not sure, so you're going to probably call the doctor and say, how much fluid do you want me to take off this patient? Or if the patient has a very high potassium. Also, medications. We talked about in the video with medications being readjusted when you're going through hemodialysis. If you have a patient on the floor that goes to dialysis, you may have to call the physician. You may have to look it up in your drug book and say, can I give this beta blocker to the patient if they're going to dialysis in 30 minutes? So again, those are all things that's part of the nursing process. And that is it.